You talked a little bit about in your overview ganglioside antibodies versus paranodal antibodies. So can you just discuss some of the differences in those two?
Sure. So gangliosides are ubiquitously expressed in both the central and peripheral nervous system. They have a lot of different functions. Some of them include cell-to-cell signaling. Some even think that their importance in maintenance of immunologic self-tolerance. And you can develop antibodies to these various epitopes, and they can be associated with neuropathies. Paranodal antibodies are directed at proteins at the paranodal sites. So these are areas that are responsible for sort of maintaining myelin loops at the nodes of Ranvier. And so what we think these paranodal antibodies are doing is disrupting these myelin loops and thereby inhibiting propagation of action potentials. So the phenotypes that you can see with ganglioside and paranodal antibodies can be a little bit different. Many gangliosides are associated with acute neuropathies, like Guillain-Barré or its many variants. Oftentimes, when you see ganglioside antibodies in association with Guillain-Barré, it's more commonly the axonal form of Guillain-Barré. It's pretty rare actually to find in kind of classical demyelinating Guillain-Barré to have ganglioside antibodies. And then there are a couple of chronic neuropathies that are also associated with gangliosides, including multifocal motor neuropathy, and chronic ataxic neuropathies. Paranodal neuropathy syndromes associated with paranodal antibodies are more likely to present like Guillain-Barré, Guillain-Barré or CIDP, sort of the chronic version of Guillain-Barré. So typically patients with paranodal antibodies will have demyelinating neuropathy. It's often very severe, and it's often refractory to IVIG, which is one of our core treatments for these patients, which can often be a clue that you might be dealing with a patient harboring paranodal antibodies if they're not responding to IVIG like you would typically expect a CIDP patient to.